think we can, I'm going to start that, and I think we can go ahead and get started. Let me pull up my form here. Great. All right. So thank you for joining us. I really appreciate you taking your time. As we continue here, whoops, sorry, I'm almost deleting things here. Okay. Thank you. As we continue to educate ourselves in the reproductive justice and reproductive access spheres, my name is Kate Rothstein, and I'm the Programming and Communications Manager at NCJW Pittsburgh, and I'm grateful that you're here this afternoon with us. We're appreciative that you're joining to discuss the pivotal Allegheny Reproductive Health Care versus Pennsylvania Department of Human Services case currently on the Pennsylvania Supreme Court docket, with opening arguments scheduled for October 26th. Last month, we looked at the SCOTUS-Dobbs decision, and today we're going to zero in our focus on PA and what could be for reproductive health care here. Before I begin, I want to remind everyone that our event today is hosted by NCJW, National Council of Jewish Women Pittsburgh. We're a progressive feminist organization guided by Jewish values, and we've become a powerful force for social change. We advocate for gender and racial equity in the Pittsburgh region and beyond. And for more than 125 years through our social advocacy efforts and service programs, our mission has always been to step forward, speak out, and stand up for the needs of all women, children, and families. And just a couple points about how we're going to run today's program. After introductions, Winnie's going to give a presentation with a slideshow. There's going to be plenty of time for comments and questions. And I'm going to request that you use the chat feature, and if it kind of evolves beyond that into kind of more of a conversation, we can do that as well. But initially, let's start with chat, and I'll relay them, or Winnie will see them and respond. And joining us here is All Above All, Winnie with All Above All. All Above All is a catalyst for abortion justice that envisions a world where abortion care is affordable, available, and supported for everyone who needs it. What began as a women of color-led effort to restore and sustain public insurance coverage for abortion nearly 10 years ago has expanded to other abortion access issues and strategies still centering people of color working to make ends meet. I am particularly pleased to welcome Winnie Yee. She is All Above All's Senior Strategies Manager, and they're going to discuss their work with the Women's Law Project here in Pennsylvania and other partners towards abortion justice in PA, including restoring Medicaid coverage of abortion as outlined in current litigation. Winnie will discuss the intersectional aspects of abortion justice, again with plenty of time for questions and answers, and she'll leave us with several PA-specific action steps. Winnie collaborates with All Above All's campaign partners to create bold and innovative campaigns that usher in proactive policy change, build the leadership and power of people of color, and shift the culture around abortion at every level. In community, at City Hall, the legislature, the ballot, and beyond. Prior to joining All Above All, Winnie worked at the National Institute for Reproductive Health, where she tracked and analyzed proactive reproductive health, rights, and justice legislation, and provided strategic guidance and technical assistance to partner organizations. A lot going on, so thank you and welcome, Winnie. And you've got the capacity to share the screen, so.
I do. Hi, everybody, and thank you, Kate, for that introduction. This is going to be like a fun sort of informal conversation today. I would love to obviously share some information with all of you about what's going on in Pennsylvania, and I have asked my colleague Rashana Lee, who is our campaign coordinator on the coverage side, to join. Rashana and I work together in the Pennsylvania work, so wanted to add her into the conversation today. Just a little bit about the agenda. We just did some welcome and intros. I'll share a little bit more about All Above All, just because I think that will help inform, the approach that we take. I'm going to give a quick recap of the history of the Hyde Amendment. Wanted to see if folks here are already well-versed with the Hyde Amendment. Do people feel like they have a lot of information about that? Or if not, I'm happy to talk more about it. But if people are already aware, I don't want to belabor the point. Can folks either put in the chat if you wanna, if you're not as familiar with the Hyde Amendment, or if you are familiar with that, just to kind of let me know so I can paste the slide deck. Review would be great. Okay, awesome. And then we'll get into sort of what's going on in Pennsylvania around coverage. I'll talk about the case in particular and then save lots of time for questions. Kate already went through my bio. As she said, I'm the Senior State Strategies Manager. I work really closely with our partner organizations in Pennsylvania and other states on abortion justice issues. And it's really important to us to not only, move proactive policy, but to also shift culture, organize in the state, and all of that. And as Kate said, All the Vol is a catalyst for abortion justice. Kate mentioned how we started out as a campaign to end the Hyde Amendment, and since then we have expanded our mission. We've always used a reproductive justice framework in our work, but we focus specifically on abortion justice because we want to reflect sort of the fact that we are talking about abortion access issues, but also we know that, someone's immigration status, their economic status, their race, all of that, impacts their ability to get an abortion in our country because of all of the sort of systems of oppression that surround that. And so we do sort of focus on abortion justice in particular, and our core constituency is people of color working to make ends meet. All the Vol is unique in that we are an organization, but we're also a campaign, coalition, and network. NCJW National is signed on to All the Vol as a partner. Our partners include abortion funds, RJ organizations and advocates, abortion providers, reproductive health and rights groups, economic justice, immigrant justice, racial justice groups, and then also elected officials are a huge part of the work as well. It sounded like you all talked about the Dobbs decision on your last brown bag, but really quickly to recap, the Dobbs decision came out in June, and it was the first time the court had ever taken away a fundamental right to an abortion. When it overturned Roe versus Wade, it sort of, quote unquote, put the issue back at the state level. Since then, we've seen abortion become illegal in over 14 states. This number, of course, fluctuates. As we saw, like Indiana's ban go into effect last week, West Virginia just signed a law, and there's so much litigation ongoing that, sometimes this number fluctuates, but that's around the amount of right now where abortion is unavailable. Beyond that, 43 states have closed because of the bans or the chilling effect of those bans. Wisconsin, for example, abortion providers, out of fear of being criminalized, have stopped providing abortion in the state. And this is a number that is being tracked by the Guttmacher Institute. And of course, we know that abortion bans fall hardest on people of color seeking care. People have been facing delays in getting care, being forced to travel out of their state. Many of them are also being denied abortion altogether and forced to carry an unwanted pregnancy to term. This map is the map that I pulled from the Center for Reproductive Rights. As you can see, in the sort of dark red maroon, those are the states where abortion is legal, and you can kind of see that in contrast to the states in blue, where abortion is protected in the state statute or constitution. And you can see Pennsylvania is in red, sort of listed as hostile because attacks can be expected and may be coming. A big part about how we got here is knowing that while Roe was monumental, right, it was a decision that legalized abortion across the country in 1973. At the time, only a couple of states had legalized abortion. And so there were people who were dying of the, what we know as back alley abortions, right? Because they could not get care at a licensed provider. And so this case was really important. But unfortunately, because of the intense backlash from the anti-abortion activists and politicians, we never got to see the real promise of Roe, right? While abortion was legal, it never became fully accessible. We still saw lots of issues when it came to access. And a lot of it was that people who had the economic means were able to access abortion, but people without it faced a lot of barriers. The original abortion ban was the Hyde Amendment in 1976. 3 years later, as you know, it was proposed by Henry Hyde, who was really direct in his intentions. He did say he wanted to make abortion illegal. He knew he couldn't do that because the highest court in the land had ruled, but he knew that he could use the Medicaid program as a way to at least make it truly inaccessible for poor women, for women of color. The Hyde Amendment was first enacted in 1976. It is a budget rider, as you all know. It pertained, mostly to like the Medicaid program at the time and some federal funds, banning it from covering abortion except in cases of rape, incest, or life endangerment. But it's been expanded ever since, just so many other federal programs. And it's been passed every year since 1976, almost 50 years now. Rosie Jimenez was the first victim of the Hyde Amendment. On October 4th, Rosie died from an unsafe abortion. She was a young mom. She was a student, a young Chicana living in McAllen, Texas, in the Rio Grande Valley. She was pregnant and didn't want to be and wanted to get an abortion, but she was enrolled in Medicaid, and Medicaid could not cover the procedure, and so she could only afford to go to someone who was not a licensed provider, and died from complications from that. Today, again, the Hyde Amendment tentacles have infiltrated so many other programs. It's in Medicare, CHIP, Native folks who get their insurance get their health care from the Indian Health Services, people who are detained in prisons, detention centers, including immigrants and migrants who are detained, people in the District of Columbia who are under federal jurisdiction, federal employees and their dependents, Peace Corps volunteers, military service members, veterans, as well as their dependents, are all impacted by the Hyde Amendment. And it just kind of goes to show that ending Hyde is so critical because it does impact so many people. And even if we do restore state coverage, there is still sort of this Hyde donut, is what people call it, people who are still impacted by Hyde. And so state actions are so important, but also can only go so far. Medicaid, right, is this program that is supposed to be supporting and giving access to healthcare to low-income people. And what we know is that there are 25 million women of reproductive age that are covered by Medicaid. I am using the term women in this case because it's the data that we have, cis women, but we know that, people of all genders get abortion care. And so I will be, using that term as well when it's appropriate. But we know there's huge swaths of our population that are covered by Medicaid. It plays an important role, especially for poor women and women of color who are more likely to be enrolled in Medicaid. And so these are the people who are most disproportionately impacted by the Hyde Amendment. We also know from many studies that Medicaid coverage is the difference between whether someone can get abortion care, or if they're denied. When someone wants to get abortion care, their decision is largely already made up by the fact if they can pay for it or not. And so it sort of goes to show that this choice dichotomy isn't really true for many people when it comes to their lived realities. If they don't have coverage, that decision is already off the table for them because they just can't even afford the procedure. The Turner-Wayne study, which is one of the best studies we have in our field, follows women who were denied an abortion at different points in time of their life. It found that because of the Hyde Amendment and restrictions on Medicaid coverage, 1 in 4 poor women are forced to carry an unwanted pregnancy to term and are denied abortion care. And it also shows that people who are denied abortion, 5 years after, 7 years after being denied, they are still facing the impacts of that. They are more likely to be financially insecure, more likely to still be living in poverty, more likely to report life-threatening health complications, both maternal and infant health complications, and more likely to be unable to get out of an abusive or violent relationship. And so it goes to show really the impact that this can have on their trajectory of their lives. We did litigate the Hyde Amendment in 1980. The case was Harris v. McRae, which went before the Supreme Court. Unfortunately, the court at the time allowed the Hyde Amendment to stand, but Justice Thurgood Marshall really called it out for what it was, knowing that it was intentionally designed to deprive poor and minority women of their right to choose an abortion, and that should not be allowed under Roe versus Wade. This map shows where we are on the coverage landscape, as I said, and unfortunately, I don't think my markings have covered onto this map, so maybe I can follow up with you all after. But Medicaid is a state and federal program, and so states, while the Hyde Amendment prohibits federal Medicaid dollars from covering abortion, states have an opportunity to use their state dollars to cover abortion care under Medicaid, and so 16 states do that. They're the ones in green, which is a great, huge step forward. Unfortunately, with the evolution of the Hyde Amendment, we are also seeing bans in private insurance and also bans for public employee coverage, prohibiting those plans from covering abortion care, as well as marketplace plans. This happened after the passage of the Affordable Care Act in 2009, 2010. Plans sold on the marketplace exchange are prohibited from covering abortion care. We see those bans added as well at the state level. And so, unfortunately, it didn't show up on this map here, but Pennsylvania would have this little red triangle or indicating that they do prohibit coverage on those other plans as well. When you look at the totality of it, more than half of women of reproductive age enrolled in Medicaid are impacted by Hyde. More than half of women of reproductive age live in a state without Medicaid coverage of abortion, which is a huge number when you think about the amount of people who are impacted by the Hyde Amendment, more than half. And of course, the Hyde Amendment abortion coverage bans are compounded by other abortion restrictions. These are the list of the types of restrictions you see at the state level. The ones in bold are the ones that Pennsylvania has, which you all probably know and are familiar with, requiring state-directed counseling that is false, designed to discourage patients from getting an abortion, 24-hour waiting period, parental consent, gestational bans, banning abortions because of sex, even though we know that's not really a thing, but trying to target specific communities of color, trap laws, and of course the harassment and violence and stigma that can also be a barrier to people getting abortion care. Currently in Pennsylvania, you do have a ban on Medicaid coverage of abortion, except in cases of rape, incest, and life endangerment. This was passed around 1985. I was trying to get the exact date. But immediately after it was passed, it was challenged by attorneys at the time in the case Fisher versus Pennsylvania Department of Public Welfare, what it was called at the time. Unfortunately, the Pennsylvania Supreme Court upheld that ban, saying it was allowed and constitutional. And to give you a picture of what it looks like in Pennsylvania, 1 in 5 cis women of reproductive age in Pennsylvania are enrolled in Medicaid and are impacted by the ban. The Abortion Liberation Fund of PA, which is the abortion fund that I know serves more of the Philadelphia area, they kind of shared who they have funded, and 83% of their callers seeking financial support identified as Black or Latinx. So we do know that the impact is being felt by Black and brown folks in Pennsylvania. On the other hand, we also know that 70% of Pennsylvanians agree that politicians should not be allowed to deny people abortion coverage just because they are low income or working to make ends meet. So we do have public opinion on our side, but unfortunately, we are unable to get rid of the ban through legislative attempts at this time. And so we brought a lawsuit. The case is Allegheny Reproductive Health Center et al., because it lists all the other abortion providers in Pennsylvania who are part of the suit. And we're challenging the Department of Human Services, the state who has to implement the ban, right? The state is the one who has to implement this ban because it is a law on the books. This case was brought in 2020, first in Commonwealth Court, because we had to start at the lower court level before making our way up to the Pennsylvania Supreme Court. And the lawsuit is arguing that the ban on Medicaid coverage of abortion in Pennsylvania violates the Equal Rights Amendment and the Equal Protection Clause of the Pennsylvania Constitution. We are bringing this case decades after the 1985 case because we believe we have a good shot at winning. This is what I got from Women's Law Project. They're the litigators, along with a couple of other lawyers representing the providers who provide 90 to 95% of all abortions in Pennsylvania. We believe we have a good shot because, number one, the makeup of the court has changed since 1985. It's a more progressive court. And number two, we have seen other states bring similar lawsuits under the same sort of equal protection claim and have been successful and won. Since 1985, we've had so much case law, so many other cases in the courts that have clarified our rights, clarified case law, and give us more reason that now bringing a case that does very much lay out how the ban impacts people because of their gender, because of their sex, because of their race, because Medicaid will cover prenatal care and labor and delivery, but it will not cover abortion, right? That is privileging one form of healthcare over another, right? And that does take away someone's right to actually choose because, like I said earlier, if you don't have coverage, if you don't have the financial means to pay for that care, you honestly can't access it, right? Because abortion funds can only do so much. So we have all that case law before us. Let me quickly go back to this map that I showed earlier. This map in green, right? You might be wondering Minnesota or not Minnesota, Montana, Alaska, right? Some of these states sound like red states. How come they have coverage? They have Medicaid coverage because of lawsuits. So these are, some of the cases that we've brought, successful cases. California has later enshrined it in statute, but prior to that, it was a court case that actually got Medicaid coverage of abortion. So we have good case law in all these other states. And these are the people, the sort of groups that are part of this sort of campaign. Again, Women's Law Project are the lawyers, are the attorneys, but Abortion Liberation Fund, they served as an expert witness, talking about the impact that they're seeing as a fund that helps people pay for care. ACLU Pennsylvania has also been part of the case education efforts. New Voices for Reproductive Justice, which is a Black-led reproductive justice organization in Pennsylvania and Ohio, submitted an amicus brief talking about how the ban disproportionately impacts Black women and girls. Planned Parenthood advocates, Pennsylvania advocates are part of it. Of course, they're providers in Pennsylvania as well. The Women's Center in Philadelphia and Delaware County are providers, and State Innovation Exchange organizes lawmakers in the state, and we've been also trying to get their support as well. So we went to the Commonwealth Court. Unfortunately, we did lose. We knew that was coming, though. We knew that the Commonwealth Court is the lower court. They don't have the authority to overturn a Supreme Court decision from 1985. Only the Pennsylvania Supreme Court can do that. So we knew we had to lose, and then we knew we would appeal and go to the Supreme Court. I'm not going to get into like the super nitty gritty of that loss, but I can talk about that more maybe in the Q&A if people are curious. But we knew that we lost. And now we appeal to the Supreme Court. They recently filed their briefs a couple of months ago. Our side files our briefs. The state of Pennsylvania files their briefs. And then unfortunately, there are Republicans in the state legislature that have joined the lawsuit, and they also filed their briefs. And at this point in time, we are awaiting oral arguments that will take place on October 26th in Pittsburgh, actually. And that's where the lawyers on both sides will get to argue, make their arguments about how this is unconstitutional. From our point of view, what would be considered a win to us is that the court restores Medicaid coverage, that they say, decided in Fisher in 1985, but so much has changed. And actually, we were wrong in Fisher, and we're going to restore Medicaid coverage. We're going to strike down that ban. And they will, a win would also constitute them saying that the right to an abortion and to make decisions about reproductive health care are found in the Constitution. It would be great if they could kind of affirm that, and that could kind of help protect us from other attacks and give us a way to litigate and challenge various abortion restrictions with that. That's kind of what happened in Kansas, right, where they just had the ballot measure, and the ballot measure was trying to say that there was no right to an abortion in their Constitution. The anti-abortion folks were bringing that because Kansas state courts had recognized that a right to abortion was found in their Constitution. So we would love if they could take that extra step as well. Other recent wins that have happened, Philadelphia gave a $500,000 grant to the Abortion Liberation Fund of Pennsylvania, recognizing that there is an influx of people coming to Pennsylvania from Ohio and neighboring states. And so that amount of funding will help them continue to serve people. And locally, the Philadelphia City Council members have also introduced a package of legislation to protect and expand abortion. A lot of it is around provider and patient identity, protecting their identities. Also sort of having that shield law to protect them in case out-of-state actors want to arrest providers or funds for helping people get care. So we're seeing lots of different steps at the local level because we know we don't have the sort of makeup and majority at the state level at this time. And then in terms of different action items, this is stuff you all probably already doing, but just to repeat, continuing to support the abortion funds, Western Pennsylvania Fund for Choice, serves sort of Western PA and the Pittsburgh area, supporting them by donating, volunteering your time if they're looking for case managers, and then also supporting the local abortion clinics. Actually, the Allegheny Reproductive Health Center clinic and the fund are sort of joint entities, which I think is great because it's so important for funds and clinics to work closely together. And then, of course, following your organization, but also the other organizations in the area. Obviously, you all follow your own organization, but these are sort of the other groups that are doing different work around education, around litigation, and I think are great people to follow if you want to be more clued in on the case. From all of Law's point of view, we are unveiling our action plan for abortion justice. After the Dobbs decision, we know that it's a huge step back for our movement, right? And Albaval's role in the movement has always been to be, that group that offers proactive legislation and policy ideas and ways to sort of shift culture. And so this is really our offering to the movement. We're releasing the full sort of action plan next week, which is our week of action, our Abortion Justice Week of Action, September 26th to the 30th. So we'll unveil the whole thing at that time. But we're really clear in that abortion should be available without unnecessary hurdles or stigma. It should be accessible for immigrants. It should be available in the communities where we live. People shouldn't have to travel miles because there's no abortion provider in their community. Medication abortion care, is something that is super safe and effective, and you can do it from your home. And so we need to get rid of barriers that are just, rooted in political ideology and not actually healthcare and science. And of course, abortion care should be covered by all public and private health insurance plans. It should be affordable. People should be able to get care and not have to go into debt or choose between groceries and paying for rent or paying for their abortion care. So I will pause there and see if you have questions. Of course, you can follow up with me over email and encourage you to follow us online, Instagram, Twitter, TikTok, and Facebook as well to keep in the loop with our work. But I will pause there.
So I have a quick question. I'm wondering, because what we're told is that if someone is seeking an abortion, they call the fund, and everything for people who can't afford it, it should be taken care of. And I'm just wondering if you're aware, is that actually happening? Are people able to access funds if they can't afford it? You know, if the Medicaid isn't there, let's say in Pennsylvania, do the funds cover the cost for people who need it, or is there still not enough money even in the funds?
Yeah, I'll say that I think what usually happens is people will Google like need an abortion in Pittsburgh, right? And then sometimes they get taken down the rabbit hole to CPCs, and that's awful and traumatic. And sometimes they'll be able to actually make an appointment at the clinic. And so when they show up, you know, the clinic will do intake, do you have insurance, what have you. And sometimes the clinics are actually the best point of like referring people to funds, just because I don't think everyone still knows what an abortion fund is, right? And knows that that resource is there. I know that Pennsylvania is a huge state, and I have less of a relationship with the Western Fund, although they are part of Alma as a partner. But I know that Abortion Liberation Fund serving the Philadelphia area did not have as much of a budget to meet the demand, that they would have to, unfortunately, give smaller pledges, or they would, you know, usually they will say, okay, we have a $1,000 budget to give out for a week, or 2,000 for each week. And by Monday, right, all of that money would be pledged away. So they would have to really not be able to meet the full amount for people. Maybe they can only cover, you know, 30% of the procedure, and that person would have to, you know, try to find out how they could come up with the other amount, borrowing, you know, from a friend, or credit card debt, or, you know, having to sell something, you know, to make that quick cash. So they are still struggling to meet the amount. Hopefully the $500,000 from the city of Philadelphia does help that fund a bit. It is a bit of a flexible grant, so it's also not going to go just to the cost of procedure, but really to help abortion liberation funds, just like general capacity, because they typically, you know, have such small staff, so they might need to add staff to be able to meet the increased demand. But that's kind of where things stand at this point. From what I know, is that they are struggling to help cover the full cost for people. I think they recently did say that they pledged either $600,000 or $800,000 in last year. So the amount that they're pledging is going up, and small dollar donations are helping, but still a gap. And it's still, you know, leaving two funds to help the entire state of Pennsylvania and people coming from other states.
Thank you. Yeah, Eleanor.
Hi, I'm Eleanor Levy, and I live in Philadelphia. And I'm thrilled to see my Pittsburgh NCJW sisters here, and to meet you, Winnie. And thank you, Kate, for organizing this. My question is, first of all, NCJW has partnered with the National Abortion Federation, and I've had the privilege of meeting a caseworker who takes on an abortion seeker and helps that person through the process before, during, after. And we have been we've been asked to donate through that. It's called the Jewish Fund for Abortion Access, which I think is a problematic title, because it's not just for Jews to give. It's not certainly for Jewish patients, but I'm wondering if you as an organization, and maybe your allies in say the Abortion Liberation Fund, are duplicating each other? Are you confusing people? do we want people to give to their local abortion funds? I'm just struggling
Yeah.
with all the possibilities for making donations.
That's a great question, Eleanor. And I think my answer would, I guess I would ask you, like, what's the goal of your donation, right? Because NAF has existed for a really long time. They're the association of abortion providers. And so they help providers with a lot of different things they come up with being a healthcare provider in the abortion sphere, right? So they do help a lot with like talking about, what insurance do you have? What's the best way to do this procedure? What insurance, where do you get your vendors? And they also have like their longstanding hotline, which is typically funded, I believe, by like larger donors and foundations, I think, less small donors. And then the National Abortion Fund has always existed and has been more like a small donor situation. So the providers who are part of NAF or are NAF members, when a patient does come in, they do call NAF as well, right? They'll do anything on their end to help come up with the funds. Like Abortion Liberation Fund might say like, okay, we can give you $300. That's what we have in our budget. And then they'll call NAF now, oh, we can give you this much, to kind of patch it all together. So it's not really confusing for the patient because, or I think it's not as confusing for the patient because a lot of it can happen with the provider since it goes directly to the provider. And I think it's really a process of just like no wrong door, right? Because some people might know about NAF because they might Google and they might find the NAF hotline first and just connect with NAF. That's great. Some people might not find out about NAF. They might find Abortion Liberation Fund first. So that's also great. But everyone is working in tandem behind the scenes. So I do think they do try to do that to alleviate any confusion. NAF, I think, being a national network, they're not only funding in Pennsylvania, they're funding in other states too. So if you're giving money to NAF, for example, you could ask them if you feel personally like, hey, we would love the dollars to live in the Philadelphia area or the Pennsylvania area, you can ask them if that's possible on their end to like earmark that. It may or may not be. And so if you are giving to, Abortion Liberation Fund or the Western Fund, they will definitely be helping people who are local to the community. Anyone coming to Pennsylvania for an abortion your funds will go towards that. It's also a bit of like a tricky environment. Like I said, there is such a chilling effect, right? And NAF is someone who has to deal with that, right? They have to assess their own legal risk, what they're willing to do. And there have been some cases where they've stopped funding in states where abortion is illegal, which I think it depends, right? You have to look at how the law is written. A lot of the law criminalizes abortion providers for providing the procedure, but might not criminalize an abortion fund for giving funds to a patient to go out of state, for example, right? So it depends on the cases. Like Texas law, I know is really tricky and does kind of get at funds. And so funds there have actually stopped also dispersing funds for abortion, but they're funding other repro healthcare. So every org has to kind of take their own legal risk into consideration. And I think NAF has made decisions to stop funding in a couple of states because of a chilling effect. And so in those states, maybe NAF stops funding, but the local fund has continued, right? So in Pennsylvania now, I think NAF is still funding, so that might not be something you come up against, but it could be something that you come up against in the future. And so you might decide, okay, I'd rather give to the local fund. I see Kate's question in the chat about like what percentage of abortion providers belong to NAF. I want to say it's like 100%, like it's really up there. There's other networks like Abortion Care Network, ACN is another membership organization. And I feel like NAF would include, the Planned Parenthood, abortion clinic, it's a bigger tent. ACN is just independent abortion providers, so it excludes Planned Parenthood. But I think there's also different sort of requirements to gain membership. And so I think NAF might have the most broad tent from what I know. Did that answer your question, Eleanor? I know I kind of gave a lot of information about like other dynamics now.
It did. Thank you, Winnie. I also know that medication abortion is expensive. So do these funds cover that? And does
Yes.
the Hyde Amendment touch that?
Yes. The Hyde Amendment touches any abortion. It's really specific to the abortion procedure, except those limited circumstances like I mentioned. I say the word procedure because if someone's getting an abortion and then they're also getting like an IUD after, right? The IUD can be covered by Medicaid, but the abortion can't. And that is sort of nitty gritty, but it gets into how each clinic maybe bills, right? So like if they're getting an ultrasound before the abortion, maybe that could be covered by Medicaid, depending on how it's billed and all of that. The medication abortion rate is the pills that people take. It's mifepristone and then misoprostol that they take at home. With telehealth during the pandemic, they did suspend the REMS. So every drug that is approved by the FDA has REMS. It's called like regulatory risk management something. It's basically the rules of how the drug can be given out, right? So like opioids have REMS attached to it. And previously the REMS said that medication abortion can only be given in person. So a patient would have to come in, take the pill at the office, provider sends them home with like the additional pill of misoprostol, and they do that at home. But there's a lot of science that shows that, you know, it's really easy to take a pill, right? People take Tylenol on their own, like, you know, you can mail someone that, right? You could do a telehealth, you could do a phone call or a video call, and you could mail it to them and they could take the pill, no problem at home, right? So as a movement, we've been telling the FDA, get rid of that in-person requirement, right? Because it's really not necessary to come in, take a pill, then go home, and especially burdensome in states with waiting periods or that require multiple visits, because it could mean a person is going in 4 times to a clinic, right, just for medication abortion. And that can mean additional, you know, taking time off work, so lost wages, finding childcare, right, trying to organize all that. It adds a lot. So during COVID, the FDA suspended that. They're like, we will allow you to do telehealth. They kind of put that order out just generally for like most healthcare, but also abortion care. And they recently announced that they would get rid of the in-person requirement completely, which is great. There are still a couple of other restrictions that we don't love, like kind of still requiring only medication abortion, mifepristone to be carried only by providers that are authorized by the FDA. So that's just kind of like a burdensome paperwork bureaucracy thing. Like you have to go through that with the FDA in order to carry it. So again, it's not like every doctor's office can carry it, which would be the dream, right? You should just be able to get it wherever you can get it. But when they got rid of that federal regulation, some states at the same time passed laws banning telehealth for medication abortion. So it's similar to Hyde, right? Where we have the Hyde standard that supersedes state law. And so theoretically, the federal FDA standard should supersede the state restriction on telehealth. But that's the question that is currently being litigated. We're trying to figure that out because a lot of red states have added their own additional restrictions. And we're trying to challenge that to say, like, actually the FDA, you know, said it's fine. So you shouldn't be able to add this additional restriction, which again, we know it's super safe, but it's just another barrier for people. So yeah, to go back to your original question, Medicaid would not cover medication abortion as well. There's no difference between like the so-called procedural abortion versus the pills, unfortunately, at this time. I'm seeing some questions in the chat. So Sarah, oral arguments, yes, are on October 26th. We don't know when we could hear a decision. It's different from like the federal Supreme Court, right, where they have to issue decisions by the end of the term. So we know, okay, it's going to come in June. Pennsylvania Supreme Court, we have no idea. They could issue it like a month after. They could take, half the year. It was all really up in the air. We feel a little bit better now knowing that we have a date for oral arguments because we filed the briefs back in March and there was so much up in the air. But now that we have a date, we're hoping we can find out a couple months after. And we'll try to sort of see how the argument goes, the oral arguments go. It's similar to the Supreme Court where, they just ask you questions, right? And it's a specific amount of time, but they can jump in with as many questions as they want. So we'll kind of see what questions we get to sort of try to read the tea leaves. But there's a lot of uncertainty with court cases, unfortunately. And then when will it go into effect? That also remains to be true, to be known, I guess, because they might say we order immediately to go back into effect. Or they might say, 30 days from now to comply. We have no idea. And I think the problem with Medicaid, not the problem, but the thing that happens with insurance plans, right, is that there is an implementation side to it. I talked really briefly about, billing codes. The Medicaid department would probably have to create a billing code for abortion care because they just haven't had it since 1985. They've had one. They have one probably for abortion in cases of rape, incest, and life endangerment is when they theoretically could bill, but they might have to update their billing codes, right? They might have to then tell every provider, hey, you actually can bill us again for it, right? And who knows if they'll even tell them, right? It might be, the onus might fall on the provider to ask, right? Just because there can be so much bureaucracy, and the Medicaid medical system is so many years behind technologically. Like they still fax everything, right? No one really uses a fax anymore. So there's stuff like that are just barriers. But trying to not only restore it, but make sure that they can bill for it and make sure that the Medicaid office responds to that. We've heard cases of providers submitting for reimbursement and the Medicaid office never getting back to them. So they get reimbursed like $0, or if they do get reimbursed, maybe they only get reimbursed $100. So the procedure costs them $300 to do, right? So it's also after this case, so much work has to be done to like raise the reimbursement rates because reimbursement rates for Medicaid are just so low generally, but for abortion, they're even lower. And that can be a huge barrier for providers wanting to enroll in the Medicaid program because they would be doing care at a loss.
So
yeah, I see Eleanor's question. Go ahead.
Yeah, I have another question. So when you're talking about barriers in place, it's in Pennsylvania. So just taking Pennsylvania example, we have providers in Philadelphia and Pittsburgh and nothing in between. So that's a huge barrier. And I'm just wondering if All Above All is looking at, if especially if Pennsylvania provides some protection and it's worthwhile to make investments. Would you be doing any work to try to increase the number of clinics in states like ours?
Yeah, I think the short answer is yes. I think knowing All Above All's niche, right? Our core campaigns right now are abortion coverage, medication, abortion care, and immigrant justice. So we definitely have worked on Medicaid implementation and insurance issues in the past. So we'll probably play a role here in that regard as well. Not only is it opening up clinics, but getting them to be able to comply with all the TRAP laws, right? If it says your hallway has to be like, 18 feet, right? You got to find a building that has that. And so I think our value add will mostly be around supporting them around like the reimbursement rate process, because it is so in the weeds. And then, yeah, I think it's mostly in that sense, because even if they exist, many providers, for example, some providers take no insurance. Like if you want an abortion, you have to pay cash credit, like upfront. And it's because they can't afford to participate in the Medicaid program because it costs more to do the care than they're getting back. But that's just a larger systemic problem, right? Because I think it's important that we fix that issue, because Medicaid is a program that does serve the most vulnerable. It serves people who are low income, who couldn't afford healthcare otherwise. And so I think it's just unacceptable to say like, okay, yeah, the provider isn't going to be a part of it because it's not sustainable for them. And it's like, what can we do to make it better so they can participate, so they can continue to give care to people who are in need of it the most, right? Who are most impacted. So I think that's something that All will look to do. But we probably wouldn't take the lead on like opening up a clinic ourselves, although maybe in another life we could do that and be abortion providers. But I think I can provide more support in terms of helping, the clinics be sustainable and identifying what other barriers they're facing and how we can help.
That's great. Thank you. Oh, Sarah has a question in the chat. Yeah.
Yeah. What action is being taken to protect abortion provider staff to make sure they are not overworked or treated unfairly? This is a great question, Sarah, that I think our field continually asks ourselves. I don't know if I'm the best person to answer that question, since I don't work at an abortion provider or an abortion clinic, but I know that, the membership or ACN, does try to offer resources to their staff, and support them in terms of, sharing any learnings from other clinics, and if providers need help with like how to manage staff and things like that. I know that they do sort of share resources together. But this is, a really important question, because I think with the pandemic, especially, like many people are feeling, the brunt of rising costs, rising rent, all these other things. And then our wages aren't going up and all of that. So it's a huge issue at this time. And something that I think clinics have to take seriously, because otherwise they will have staff turnover and not have good retention and not be able to kind of operate the way they would like to.
I have one more question. So, we try to do a lot of education because we feel like it's important that our network knows the different pieces and what's happening and what's current. And so every once in a while I get the sense, and I may be wrong, but that there might be more of an appetite for actually getting out there and doing sort of actions, being an escort or being a driver or things like that. And I'm just wondering kind of what your thoughts are on the education component of being an ally, of being a supporter, versus the more sort of traditional out there actions.
Great question, Kate. I don't know if you all saw like an uptick in people interested in getting involved after the jobs decision. I think like that was a huge wake-up call for so many people, and they're like, I want to get involved, right? The most important thing is sustainability, right? Because we need sort of volunteers now, but we also need them a year from now, 5 months from now. I know a lot of the clinics in Texas and other places were getting inundated with people wanting to volunteer, and then people were frustrated. They're like, oh, the fund never got back to me. And it's because the abortion funds, the workers or whatever, they were dealing with the crisis and the immediate aftermath, and they didn't have time to vet volunteers, right? So what we really need is people in it for the long haul. And I think donating is not something to be discounted, right? Donating money is something that is actually goes a long way for the abortion fund, because at the end of the day, you know, again, money is the difference between whether someone can get the procedure that they need, which is a time-sensitive procedure, or not. So I never want to discount that. People are like, oh, I feel like I can't do more, I'm only donating money. That's still amazing. And then, you know, if you do have the time to be a clinic escort or to be a case manager, you know, it's not for everyone because it does require, you know, you being there maybe really early in the morning when the clinic opens, right? You are dealing with protesters as well, and it might be cold or rain. You know, it's not for everybody. So I think find out what works for you and do that thing. But one small thing is fine. If we all do one small thing, it all adds up, right? So I think just donating, and then again, yeah, keeping in touch with the information. There are so many people in our community where they might not be seeing the same thing we're seeing on a day-to-day basis, but you being their friend or their acquaintance can be the person who gets through to them, right? By sharing something on your Facebook, sharing something on your Twitter, it can be that conversation starter. So I do encourage people to like follow different accounts on social media that are putting out, you know, trusted information, and sharing that, because that can go a long way where people aren't thinking about this issue on a daily basis, but, you know, something catches their eye. And so I think staying involved and trying to get information about what's going on in the legislative session from NCJW or other sources like that is really important too. And yeah, doing phone calls, sending that email. A lot of organizations try to make it as easy as possible to be like, just click this and you can send an email to your lawmaker, right? So that also is really important too. And I think those are quick things people can do to kind of stay involved.
Thank you. Does anybody else have a last question? And I did put a link to our post-program evaluation if you have a minute or two to fill that out. So it's just a handful of questions. But does anybody have one last question? And yeah, Winnie just put her email if you have any questions for her specifically. All right, so for me, the hour went by very quickly, and thank you, Winnie, for sharing your expertise and for keeping us up to date. I've added those links, and our upcoming events are at ncjwpghevents.org. I can put that in the chat as well. And thank you. I know Rashana said she was here to be support and to learn, and so welcome and thank you for joining us as well. So thank you everybody for joining us, and I hope we'll see you on another Zoom call, and that you stay with us in this and stay with All Above All and NCJW and everybody doing this work. We're very appreciative, so thank you.
Thank you, everybody. Please don't hesitate to get in touch if you have anything to follow up on. Thank you, Kate, so much for organizing as well.
Of course. All right, take care.